Hi, my name is Sharice Mashishka, and I'm going to be your student nurse practitioner today. Can you tell me your name
Rick Mishishka,
and what's your date of birth?
8/15/81.
All right, so I am going to wash my hands. I am going to close the curtain to provide privacy for you, and I am going to be doing your abdominal inspection. Is that okay?
Sure.
Okay, first of all, do you have any pain anywhere? How are you feeling today?
Oh, feeling fine.
Okay, so right now I am going to lay you back flat. And then as we get flat, I'm going to ask you just to lift your shirt so I can see your abdomen. Okay. So right now, first, I am just inspecting. I am looking for any maybe scars, any stretch marks, any lesions, any bruising. I'm assessing color. And obviously I can see him breathing, so I'm also looking at his rate and depth of breathing. So that's for my inspection. I'm also looking to see if there's any peristalsis or any obvious patterns of his abdomen, which it looks okay. So now I am going to go into auscultation. I'm going to listen with the diaphragm of my stethoscope, and I'm going to listen in all four quadrants. And I'm listening for any tinkling, any pinging. I should hear about 5 to 30 a minute in each quadrant. So I'm going to listen real quick. Starting with the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. And you have normal active bowel sounds. So while I'm listening to your stomach, I'm also going to listen to your aortic, going into your renal, iliac, and your femoral arteries. I'm auscultating for any bruits, and I'm going to listen to that with the bell of my stethoscope. So I'm going to listen to the aortic, which is a little bit above your umbilicus. Going into the renal. Down to the iliac. And being that he has clothes on, I'm not able to listen to his femoral, but then I would also use the bell of my stethoscope to listen to his femoral arteries, and those sound within normal limits. There's no bruits or thrills with that. So as far as I've inspected, I have auscultated. Now I'm going to percuss. I'm going to percuss each quadrant of his abdomen. I should be listening for tympany, and that is just to let me know that, there's no air or anything in his bowel. Good. So I'm also now going to do a little bit of light palpation. So I'm going to use the fingertips, and I'm just going to lightly palpate. And I'm palpating for any masses, any bulges, while observing his facial, making sure there is no pain or any tenderness. Any pain or anything?
Nope.
No. Now I'm going to go into some deep palpation. I'm going to press a little bit. All right, so I'm going to look at your intercostal margin, and I'm palpating for your liver, seeing if that's enlarged. Can you take a deep breath for me? In. Take a deep breath in. All right, you can let that out. And then I would want to palpate his spleen. His spleen is over here on the left side. It's usually hidden up under the rib cage. So I'm all ticklish. I'm also going to auscultate for any hepatic bruit or splenic bruit or thrills using the bell of my stethoscope. Now I'm going to percuss your liver border. So I'm going to start down. Okay, do you mind taking a deep breath in for me and holding it? So that's about there. Okay. It's about 3 centimeters. Okay, so I have inspected, I have auscultated, I did light palpation, I did deep palpation, and now I'm just going to assess like some of your, I'm going to look at your jugular veins, your carotids, and I'm going to auscultate. I'm inspecting, looking for palpations. I'm going to take a listen with the bell of my stethoscope. And this way. All right. And now I am going to kind of come around this way. And I'm just looking at I'm going to palpate your pulses. So your radial pulses, I'm looking at rate, rhythm, character, they're normal. I'm going to go up to your brachial pulses. Good, also checking the rate, rhythm, 2+, both of them. And then I'm just starting, I'm palpating, I'm feeling nice and warm. I'm going down to your fingertips. Everything's nice and warm. I'm looking at your nails, checking for clubbing, checking your capillary refill. That looks good, and I'm going to do the same with your lower extremities if you don't mind. Checking for, I'm inspecting, I'm palpating, I'm looking at your hair distribution, looking for any venous or arterial insufficiencies. I'm checking your pedal pulses. Good, 2+, checking for rate, rhythm, character. I'm checking your post-tibial pulses. Good, those are both 2+, and I'm checking the capillary refill. About 2 seconds on each. Okay, do you have any questions for me?
No, ma'am.
All right, thank you for participating, and you have a good day.
You too.